My name is Andom. I am currently studying at Indiana University School of Nursing. I migrated from Eritrea, a country in the northern east part of Africa, to the United States of America. I was born and grew up in Eritrea, and I attended high school at my village. I obtained a high school diploma, and thereafter I attended a teacher training college, became an elementary school teacher, and I worked as a teacher for 2 years. Due to the war between Eritrea and Ethiopia, I was forced to live in a refugee camp for 6 years. Living in a refugee camp was hard because of the lack of life-sustaining amenities, such as drinkable water, electricity, shelter, and even food. There are some times that we may not have anything to eat for 2 days. In addition to this terrible situation, the severe weather condition caused lots of health debilitating diseases in the lives of some of my colleagues. Coupled with living in an extremely hot weather, many of my colleagues developed various forms of health debilitating diseases such as bronchitis and pneumonia as a result of the frequently occurring whirlwind in our time. Malaria and other diseases infected many refugees, and some of my friends died of malaria in the refugee camp. There was not enough help or assistance given to refugees except the aids which were given by United Nations High Commissioner for Refugees. In the refugee camp, I was one of the elected committee who were appointed for the distribution of donated items to the refugees. Due to the shortage of nurses in the refugee camp, I was assisting the volunteer nurses in distributing medical supplies and sometimes helped critically ill fellows to their bed after receiving treatment. My desire to be a nurse developed at the refugee camp because of the lives of many refugees which were saved as a result of nursing interventions. Through my personal experiences, nursing is a calling, means you do not only have a passion for the work. Even though I worked unofficial as a nurse in the refugee camp, I now know studying nursing will play a key part in helping patients and families. Taking professionalism in collaborative practice has enabled me to think beyond my imagination about nursing. Now, I have learned what nurses can do. Nurse also requires skills such as good communication and excellent listening, ethical responsibility, critical thinking, and the ability to answer questions. My responsibility is to develop those skills in order to help my patient as much as I can. A call can be sustained over time if the person who has been called prepares and equips himself for the physical and emotional requirements and the demand of the call. Although I'm still figuring out on how to meet up with the emotional requirements needed for this profession, I believe I will know it during the course of my learning in this nursing school. So, sustaining a nursing calling requires adequate training and up-to-date information that can make the person to be competent in this profession. In short, it takes total commitment, which is giving everything it takes for a call to be sustained over time. All in all, nursing is a way of life, a way of relating and caring that is essential to us all. Thank you for